Well, welcome everybody. It's nice to see you. Thank you for joining us today. I am Dr. Meena Julapalli of Bluebird Dermatology. I'm a pediatric dermatologist in Houston, and I am joined today. This is actually really exciting because I have kind of multiple people on today, but I'm joined today by Dr. Olivia Friedman of Amethyst Holistic Skin Solutions. She is a traditional Chinese medicine practitioner who specializes in skin. And I have some very special guests today here too, Amanda and Nilton Vargas, who we both collaborated with to take care of Nilton's skin. If y'all want to kind of introduce yourselves a little bit and then we get going. Dr. Olivia, I'm going to have you introduce yourself first.
Sure. So as Meena mentioned, I'm Dr. Olivia Friedman. I'm trained as an herbalist in traditional Chinese medicine. I had the great opportunity to meet Dr. Julapalli at a conference, and we got to talking and we got to better understand what we both can bring to a table. And when Dr. Julapalli had some patients that actually were having different kinds of concerns and issues, we were trying to put our heads together and figure out a way to work together. And I think it was a really, really great collaboration because, as we all know, I mean, every single medicine has its positives and it all has its limitations as well. So it was a really neat opportunity to work together with Nilton and his parents and his mother. And they were fantastic to work with. So, I mean, that was another plus of making this whole collaboration work well.
Thank you for that. And Amanda Nilton, I'm going to have you introduce yourself a little bit, and then we'll kind of go back to where this whole collaboration started and go from there. But go ahead and introduce yourself as well.
So, hi, my name is Amanda. I'm the mom from Nilton. We started working with Dr. Julapalli and Dr. Olivia after many months and research in how to we can help Nilton with his skin conditions, with atopic dermatitis that was uncontrollable. In that moment, we look everywhere, and I have a referral from Dr. Julapalli. In that moment, and we immediately drove for 1 hour. We are from Houston, and she's in Spring, Texas. And then she introduced to Dr. Olivia that we worked for almost 2 years together, and was tremendously helped. You know, the team, along with Dr. Chen, his allergist. So yeah. And we're still working together, maybe seeing each other less time than before. But yes, we've been working and fighting against the eczema for many years.
So I wanted to kind of go back to how this whole collaboration started. You know, when Nilton and Amanda first came to see me for the first time, correct me if I'm wrong, but you already been to an allergist. You'd already been to maybe multiple dermatologists, and you'd been off and on increasingly potent topical steroids to take care of your skin for quite a while, but it was continuing to get worse. You had even been started on Dupixent before you ever even came to see me, and at that time, you were still getting worse. I just remember the very first time that I met you, I actually couldn't see much of your skin because it was all wrapped up. And we had to kind of take everything off to really see what was going on. So, so when you came to see me, it was probably at one of the lowest points in your eczema journey. And even as we worked together, I had been struggling a little bit with kind of knowing what to do because you were kind of on all the big guns. Typically you had already gotten to that higher stage and level of care. And I reached out to one of my mentors, Dr. Peter Leo, who's one of the eczema gurus, and he's always so generous with his knowledge and resources. And that's where he suggested that I reach out to Dr. Olivia. And, I'm a very open-minded person. But at the time, to be honest, I knew very little about traditional Chinese medicine. But at that point, I didn't think we had much to lose and only things to gain. So Dr. Lear, I'm going to start with you. What does integrative medicine mean to you?
That's a really great question because I think it means so many different things to different people. To me, it means, taking the best of East and West and putting it together for the best outcomes for our patients. End of story. I think a lot of people define it as, very specific types of treatments or, something that all practitioners can do. But I really think that it's taking everything that's available in medicine, whether it be East, West, everything else, and just figuring out what is the best solution for our patient, because everybody responds to every kind of medicine differently. Some people don't respond to some medicines at all. And so instead of this war of like who's better or what's better, I think we really have to think about the patient, and we really have to think about what works for them, what is the most comfortable thing for them, what is the most affordable thing for them, and to think about all the different consequences that somebody brings to the picture and to find that best solution for them.
Yeah, and I kind of feel like in a way I have always been practicing integrative holistic medicine. By that I mean that just having that open-mindedness to try different things, because not everybody follows the textbook. It's a good reference point, but I mean, I know from personal experience, even in my own family and what I've experienced, is that people don't follow the textbook. And in fact, one of the things that I used to teach my students when I worked in academic medicine is that you might see numerous patients in a day who might have a similar condition or diagnosis, but you must remember that their experience of their condition is unique to them, that everybody has a unique story to tell, and you have to take the time to listen to their story, because the way you treat them will be unique to them. It's not the same. Their understanding might be different. Their, as you were saying, like, their background, their environment, their nutrition, their support system, their struggles will all be different. And if you don't know where they've been, you can't really effectively help them get to where they want to go. So from that standpoint, I actually feel like, Amanda, from the get-go, I mean, even in just your approach to being as open-minded as you are and wanting to have different opinions, I think you've always been very open to this very integrative and collaborative approach, because when you came to me, you were not just looking for medications. You were looking for kind of the bigger picture. Like, how do I support Nilton with nutrition and what, just even stress reduction, mindset, and also the different kinds of medical things that we might be able to help them with. So tell us a little bit about kind of how you came to that understanding.
So after many years where we're dealing with, with eczema since he was born, it's always an easy fix or just easy for us, go doctor, get a prescription, get fixed. And, in certain time of his life, was controllable, right? But when he started growing up and, along with his allergy, we noticed then medicine, it was always needs more, but never was enough, right? So when we start notable, then we need a change. It's when I start looking for different research. So looking in, different diets, looking in different natural, approach, then like the Chinese medicine, and not just medication, and also help him with with the mindset, with this, manage the stress, manage what is the environment, was many, like a group of items that we need to control all together for he can go in balance and start getting better. So that's how both of us, we do many research, and we get with you, and and not just for the medication, just simple, just a conversation, you and him, make him feel better. And that's my opinion. When we start working together, with Dr. Olivia, is when he start getting better. When he start making his mindset like, okay, this is where I am, and I need to do this along with patience, and faith, and with what we're doing was the correct way, with Dupixent, with Dr. Olivia herbs every month that we keep searching, changing every month, depends how was his condition, with diet, with also even with therapist to help him to how to control his itching, his breathing, was many different areas that we have to approach and work together for him to start getting better.
I'm going to actually go to you, Nilton. I see a lot of the patients that come to see me for eczema usually come when they're very little. But the first time I saw you, it was, shortly before your 17th birthday, and you'd been dealing with this pretty much your whole life. So how was that affecting? You mean you're in high school, how is that affecting just how you, well, I know the answer to this question, but for the audience, how you were at school, how your relationships with people, your family, your friends, and girlfriend, all of those things, like how was this affecting your quality of life?
Yes, before with eczema, it was very easy to deal with, as my mother said. It was like just an easy fix, just put a little cream on it, and that'll be the end of it. But later on, growing up, it ended up being more and more and more creams, more ointments, and all different kind of stuff. With the STW, it got more difficult because my skin got drier. I started going to different places. I started becoming more difficult to go outside and just live a normal life with other people. And as things started getting more and more worse, I couldn't even go to school anymore and enjoy the simple things and just stay at home dealing with the aftermath.
What would you say was kind of the turning point for you?
I remember one day I went to my mom and asked her about something from my skin, and the next day it was just like a whole mess with my skin. I couldn't do anything. I just had to stay in bed and not go to
It
school.
was burning.
Yeah, with burning pain.
One of the things that you had asked me, Amanda, and because it was so, it was something that was just so genuine coming from you, that you said, this is gonna make me emotional, but you said, I just want to see him clear by his 18th birthday. And this was shortly before I actually had met Dr. Olivia. We had already talked about you. We were already collaborating with you, but I had never actually met Dr. Olivia in person until an integrative dermatology meeting. And we had a lot to talk about. In fact, I've never had a conversation with Dr. Olivia that was less than an hour to this day.
That's true.
It's absolutely true. We just have we are just very much on the same page in our philosophy and how we, live and love and serve in the world. And I say that a lot, but so I did take it to heart. What I wanted to see, because when the very first time I saw you, I mean, like I said, you were wrapped up. It was not a good time with you. You weren't able to go to school. You really weren't able to do much at all. You weren't able to do any of the things that bring you joy, which we'll talk about because you are able to do those things now. But it was just a goal of mine to, can't promise magic. I didn't know if you would be clear by your 18th birthday, but what I wanted to see by your 18th birthday is your smile. And I promised you that I would get you to a point that you would at least feel confident enough and to have hope in the direction that you are going. And I kept that promise because I have that picture. And it was such a, that to me was kind of the turning point of just everything that we were trying to do and accomplish. We weren't clear yet at that point, and even now you have moments here and there, but from where we started to where you are now, to your, you can tell them kind of where you're at now, but you're in college now. You're in college, you're doing things on your own. You're much more independent, because at that time, you were very much dependent on your mom to kind of take care of you for kind of everything. And I guess, it's easy for some, well, it's not easy, but for that just to be an expectation when you're a younger child. But I have to, that had to have been pretty difficult, as a teenager, going through high school, almost in college, to not be able to do a lot of the things for yourself. So talk us a little bit through that and kind of what helped you get through that.
Yeah, there's a lot of things I couldn't do by myself, just like eating by myself, because not only was just my face, but both of my arms, and I couldn't move them at all. Eating, sleeping, just all kinds of normal daily activities I couldn't do by myself. But going to you and just like your positivity really helped me going through it, with all my family too, just all the support, even when I didn't really see much hope after many months of see no progress. Little by little, I started seeing hope with you guys.
And Dr. Olivia and I had talked about this before, but we are such huge admirers of you, Amanda, because even from the very beginning, when maybe in, with Nilton having to be kind of wrapped up to take care of his skin, to protect it, all of that, one thing that you never lost was hope and faith. Even when you didn't see where this was going, you never lost that. How do you do that? What is it that gives you that level of strength? No, it's okay. I'll give you because it's just something that it was such an inspiration for us to do as much as we possibly could, so that we were all on the same page to get him to where we went, because of your strength and resolve. And I just want to know, where does that come from for you?
I think, the first thing is just the mother's love. When you see your son going through all that.
Okay, it's okay.
It's like a breakthrough, just remember all that. It's just, you getting, like I told him many times when he told me, Mom, I can't. I say, yes, you can. You need to just look inside of yourself and getting the strength from inside of you, and that you don't know that you have, and keeping the faith and the love in our God, then then we will be fine. And then God put the right person in front of us, and we're going through that, and we're going to fail many times. I told him every night, and I said, we're going to get up, and we will keep fighting. If this don't work, we keep looking until something will work. But I told him every night that we prayed. I slept with him, like for 8 months, because he cannot able to sleep, alone, because he was in so much pain, itchy, burn. It was running to the fridge every night to bring ice packs to help him to calm down the burning, or putting some creams, or when he was oozing, some spray with the herbs to dry out. Was many different things that we learn with the time, but the strength is coming just with the support, not just from me, from the support from my husband, that he take care of my daughter, for everything, because I was with him 24 hours, and I was also working. I have my full-time job, but working from home, and and my husband, the rest, my mom, she came, to stay with us, and she was helping with all the food. We were blessed to have a family that understand, with the eczema and TSW, to going through that. It's a sickness. I call it sickness. It's a syndrome, then we did not deserve to anybody, for children to adults, and not just for the persons going through, it's for the whole family going through. It's seeing your child going impaired and burning skin from head to top, and it is hard, and the strength is coming from our faith. Then there will be better. And I know some people, they still suffer, they take more long time than us, but I told him, every person is different. Like you say, every person even is diagnostic with the same syndrome or the same sickness, every person is different, and we need to keep fighting and to do better. And I think in keeping positive mind was a better option to be negative. Being negative will be not help us to go anywhere. And that's, when me and my husband started looking for research, and how to help him besides the regular medicine, is when, they start getting from there, getting every morning, do the routine, the body, clean the skin, wrap it up, put in the ointments, drink the herbs, a certain time, or take the medicine a certain time. It's a help me, because, not just for me, as a mother, it's for his life. He was very young when he started affecting his life. He was 16 when everything started getting worse, that he was not able, to go out and make a lot of research, how to help him to reduce the stress. For example, like, I know for him going to school was worse than his burning skin, because of course, people look at you, feeling uncomfortable. So I'll get out, with you, with the program, the 504, with the schools giving another support. We decided to withdraw him from school and put him in homeschool for 1 year, right? For 1 year, we did a homeschool for him. And that helped tremendously too, that he can relax, he can do at their own pace, assignments without, the stress to go out and worry, oh, you have to sleep or you have to get up a certain time. It was all that combination. And from where is coming all this? I don't know. It's just the hope and the faith and the love. Then look for everywhere, from Dr. Leo, from Dr. Olivia in Chicago, from you, from many different, order of those type of ointments to help him to get better. But I think the best, medicine was, working together, having a great team and support him mentally. I think it was a key, along with something that, the people is helping you by heart, and provide you those research, like the herbs. Then, Dr. Olivia every month, like, okay, which symptoms you have right now? You cannot sleep, or you have more burning here. Okay, we need to look what we can do to change. Everything was for him to keep fighting, the TSW, and keep fighting. And we still are, but I always keeping him, when you keep your positive mind, you keep your hope, God is with us, and he will not abandon us, and he will give us the research to find to keep getting better every day.
One of the things that, which you so beautifully touched on, that I tell kids of, how in order to take care of what's on the outside, it's really important to take care of what's on the inside, how we think, how we feel, what we put inside our bellies, how we move our bodies. And in that respect, I feel like a lot of very, older health models have done a lot better than our Western models or allopathic medicine models. And so, Dr. Olivia, with traditional Chinese medicine, what I have found in being able to collaborate with you is that it very much addresses finding that balance, back in not just our bodies, our minds, all of those things. And I guess I would like a little bit of kind of understanding of how you decided to kind of focus on the skin as one of your specialties in all of this wealth of knowledge and wisdom that you have.
Yeah, sure. Before I answer that question, I just want to get back to the one thing about Chinese medicine is like we really do look at people as whole people, right? And what Amanda was touching upon is that yes, there was this physical thing that was going on with Nilton, but how he was feeling about it and how he was dealing with it is all part of that picture too. And so what I love is that she picked up on that right away, got him help for that as well, and was like, we're going to take care of all of you, Nilton. We're not going to just take care of like what we see on the outside. And, TCM is really about, we are a microcosm, each one of us, of the macrocosm of the world. And so we're always interacting with the environment around us, and everything that's going on with it is affecting us in many different ways. So I really kind of fell in love with this medicine because of that, because it really looked at us from every single aspect of what we are, not just what we are physically, not just the systems and organs that are inside of us, but also all the emotional, psychological stuff that goes on with us too. And we don't say that, you have a condition, therefore you're now going to have these emotions. We say you have a condition, emotions come with that. And so we got to take care of all of that. So I actually got into this medicine because I actually was someone like Nilton at one point in my life. I had really severe eczema for most of my life and was on all kinds of different drugs. And at one point I was on 7 different drugs at the same time to manage all the different things that were going wrong with me. It was a really rough way to live because I was always waiting for the other shoe to drop, as Nilton and Amanda have been talking about. It's this constant up and down, and it gets worse and worse a lot of times. And, you just never know like when that next thing is going to happen, that next flare, and how much it's going to take you out of life, right? So I got to a point where I was just like Amanda and Nilton saying, okay, I am trying everything that we are traditionally giving to somebody who has what I have, but it's not working. So what else is out there? And that's when I started opening myself to, other methods of treatment. And I happened to fall upon this TCM provider. And upon looking at me, he said to me, yeah, I can take care of that. I think we can make that go away. And I was like, wait a minute, no one has ever said that to me. Everyone has said, we can manage this and we can give you a whole bunch of different drugs and we can like handle it, but it's never going to go away. So I was intrigued. Sure enough, within 6 months, all of my eczema symptoms went away. I also had anaphylaxis, that went away. I also had a bunch of sensitivities and stuff, and that went away. Probably took a little bit longer than the 6 months, but I was, for all intents and purposes, cured and never had any of that stuff come back. And so, as you would imagine, that's a pretty profound thing to happen to you when you've been suffering all your entire life and suddenly you're not. So I decided I really needed to learn how to do this and to help other people who were just like me, who were not getting the right kind of help that would actually resolve their situation. And so I actually quit my corporate job that I had been in for 25 years and went back to school and learned how to do traditional Chinese medicine and specialize in dermatology. And so that's where I'm at now. So I'm here because I just want to help other people who were in the same shoes that I was in. And I'm just really, really moved by how much things can happen for people. And I want to bring that to people if they're responsive to the medicine. Obviously, if they're not, I want to be that person that helps guide them to the next person who can help them. And, that's why I partner with people like Dr. Julapalli, because I know sometimes I can't do it all. And sometimes what she's doing can really help somebody. And so I want to be able to say, hey, I've got this great person you can go to. They will take care of you.
The quickest way to get board certification in pediatric dermatology is actually through a dermatology residency, and then a pediatric dermatology fellowship. But I didn't do it that way. I did a pediatric residency first, I did 2 residencies, a complete pediatric residency, and then I did dermatology, and then I did pediatric dermatology. And people always say, well, do you feel like that was a waste? Absolutely not, because as pediatricians, patients come to us to help them with their overall well-being. So it trained me to see the bigger picture, the whole patient, their fears, their concerns, their challenges, their hopes, their dreams, to know how to advocate and support my patients, to know where to look for resources, and to know when I'm out of my league, when I don't know that what I'm doing isn't enough, that I have the humility and the curiosity to go out there and find what can I do to help my patient? Like how can I make it possible? And then then dermatology helped me kind of hone my craft, but it's sort of it's sort of the way that I've always practiced it, and I love that I have even more, and it never ends, right? Just having knowledge. Anybody can get knowledge. You can go to Google and search anything, but the wisdom that you gain from it comes from experiences, from curiosity, from understanding, from wanting to know more, because I actually think that's the beauty of the human body, that we actually know so very little, and a lot of it is kind of a little bit of trial and error, kind of figuring it out. Sometimes there's, I guess you probably gone on Google. A lot of people go on Google and they do these like little quizzes of maybe it has to do with Ayurveda or traditional Chinese medicine, where you can put some answers to questions, and then it gives you a little algorithm. Okay, you're this element, or this body type, you're predominantly this and that. But there is no quiz out there that can tell you, any algorithm. There's no textbook out there that can tell you exactly what you have to do. It is taking in all account of all of those things that we talked about, that we've all done in our own way to get to a point where you're at now, Nilton. So, to kind of round it out, where are you at in life? Tell me, we've talked a lot about your struggles, but I want to know the story of triumph in it all. Where are you at in life? What are you doing? What are the things that you are able to do now that bring you joy?
Right now, my first year of college, driving there every day, playing volleyball for my school. There was this once interaction I had recently. Actually, one of my fellow classmates came up to me and asked me if I had eczema, because he saw my skin and face, and because he also had eczema. So then we started talking about it, and he was telling me about his little brother, who's also on Dupixent, and his struggles. And I was just telling him how about mine and everything I went through, and suggesting some things about it too.
So what what I love about what you just said is that I have this kind of practice philosophy of educate, empower, advocate. What I mean by that is, we all start at a place of where we don't have a whole lot of knowledge of what's going on. And sometimes we have to seek it out either through research or from getting help from somebody. And a lot of it is hearing each other's stories, just knowing again where things have been, what you're experiencing now, where you want to go, and how we can work together to make that happen. And then you get to a point where there's that hope, this collaboration that we're doing, it's making a difference. Something's happening. We're actually getting to a point that I have faith that this could turn around, that this could get better. And then there's that place where you feel so empowered that then you start to advocate for not only for yourself, but for others. And you did that. Like now people are kind of seeking it out in you, and you're passing on all of the knowledge and wisdom and strength that you've gained to be able to, and and what you're doing right now, that the story that you're sharing, I guarantee you there's people out there who've experienced maybe not the exact same thing that you're experiencing, but hearing you have the courage to tell your story allows them to feel that they have that support, but also the strength that gives them hope that their life can be different as well, that they can do things, that there are resources out there, there's support out there, that they can look to you to be inspired by what you've experienced. And I think that's just so beautiful. You completely are at a stage where from where you started to where you are now helping other people through their struggles. And I know people have heard me say this, and I'll say it time and time and time again, is that when sometimes I'll tell people that what you're experiencing right now is going, even if it's painful and it's a struggle, it will become a superpower. And by that, I mean that the pain and suffering that you experience will make you kinder, more compassionate, and towards the pain and suffering of others, so that you are their person who's going to advocate and empower them as well because of what you have experienced. And you are just both of y'all are just a shining example of that. And I couldn't be prouder of that. And there it is. There's that smile on your face that we all worked so hard to see. And now it's just there all the time. It's just a part of you. So I'm going to give all of you the last word. Dr. Olivia, why don't we start with you? Is there anything else that we didn't touch upon that you wanted to add before we end this call?
I just wanted to say it was really a beautiful partnership in so many different ways. I mean, not just bringing together different ways of approaching the treatment, but Nilton and Amanda are just beautiful people. And it was always such a pleasure to always meet with them. And as you mentioned before, Amanda was just so strong and so positive every single time we got together. And it's so understandable if you were getting to a point where you were frustrated and starting to take it out on people or whatever. I totally would have gotten that, but you were never like that. You were always like, we're gonna figure this out, we're gonna get this done, Nilton's gonna get better, we're gonna and it was just so inspiring. As Meena said, we just felt like we had to come through. We had to do everything in our power because we could not let you down. And Nilton, I will have to say that you're probably one of my favorite. Don't tell other patients this, but you're probably one of my favorite patients because exactly what Meena was saying earlier is that when you first came to all of us, both of us, there was definitely the light was not quite there. It was very dim, right? And to watch you from month to month to month, to start having this shine in your eye again, the sparkle come back, to start seeing you actually start to want to do things, to actually hear from you and say that, I went out and did this, or you know what, I'm thinking about going back to volleyball. Those kind of things are the things that we love to hear. We love to watch. And it's just those are the moments where we're like, this is why I'm doing this. This is so great. And you totally inspire us to want to do this for more people. So thank you so much for your partnership, your beautifulness. It's just been such a lovely, it's more than a partnership. It really is. And it's really been special to be part of all of this.
Amanda, I'll give you the second to last word, and then I'll have Nilton close it out for us.
I just want to remark, one key point when someone suffer, not just for eczema, for also for topical steroid withdrawal that we went through. It's about the support. When you have a balance in support with your from support from your family, but most of all, you have a support from your medical team, then it was many times that I went out crying from doctors' offices, when we need to do this or we cannot do that. It's like feeling hopeless, in certain times. We visit many different treatments they want to do with him, and I didn't feel was the right for him. Then we were not looking for. And when we found, this collaboration between you two with his allergist, also Dr. Chen, then I have to, also give him a pro, then because we all work together, is the faith and by heart want him to get better. It's also pushed me through, and I keep advocating for you too when they're asking what helped Nilton, because I have the best doctors there, then support him mentally and physically, and I cannot ask for a better team, than that was you two, that's for you, and to he can go better, and we still there, fighting, but I think that's the biggest thing to find the correct people to work with you going through this syndrome. Then for one reason God put us there, but that's the first reason that we able to work together to to learn about it, to advocate and to help different people with the same symptoms or worse or less, and I think this is an advance for integrate medicine versus the traditional medicine. To it's more than a prescription there. Then you need more to nutrient in your body, to heal your body from inside, from outside, from mentally, from from all a part of the aspects, from love your body, to giving the healthy food, to care about yourself, mentally health, fighting depression, fighting the society, because it's also too, we fight not just with people, we fight with the child system. They come to my house because they thought that I was not giving the correct treatment to him, then I was abuse him. So we fight with many different state process, then want him to go with the regular traditional medicine for him to go better. But when I start showing him Dr. Olivia prescription, your prescription, what we were doing, why he was doing better, they understood. Was one point they understood, they agree what me and my husband, what we're doing was the best for him and for for the whole family. So it was a big fight with doctors, and with the state, to to integrate and welcome this integrative medicine, for help him to keep living, not just to get better, it's just to keep living, because we're still doing it. We still use the ointments from Chinese medicine. We still have the diet, to keep the inflammation, a certain level. We can still keep the mindset, it's, and I told him, and I told this to Dr. Olivia many times, he needs to learn all this, because, I'm not saying that he will be one day completely cured, but he knows how to manage his body, how to treat his body from inside and outside, he will be okay. And I told him many times, maybe tomorrow will be another flare, but we'll be getting through again. I told this to Dr. Olivia many times. If that happens again, will we go through again, and will we do better again?
I was just about to say, and you actually just touched on it, is that there was a period of time where you were very dependent on your mom, but nowhere in that did she ever allow you to not be a part of your care. There might have been some times where you're like, I can't do it, but she always pushed you throughout to be an advocate for yourself, to learn about how to take care of your skin, why you're doing it, what you're doing, so that she actually encouraged your independence. Even if you needed help at times, she always encouraged your independence for you to get to a point where that you have that confidence to know how you can best take care of yourself, that you build the intuition of what your mind needs, what your body needs. And she was always, maybe there were times that you didn't actually like it, but I think that was very instrumental for you to get where you're at now. So Nilton, what would you say to another kid, especially teenager, because like I said, a lot of families who come to see us, or they're coming to us when they're younger, but this is potentially a much longer term struggle, in many ways, sometimes lifetime. So for someone who is going through like high school, who's kind of struggling at the sort of the worst of it, in a time that is a huge struggle to begin with, and just how you're developing your identity in the world, what would you say to someone who's kind of at the start of it? Because now you've kind of you haven't overcome it. You're still going through a lot of those things, but you're definitely at a much better place now. What would you say to someone who is at the beginning of it, kind of like when we first met you?
To keep the patience, to have hope, to don't like exclude anyone that's around you, keep everyone in, and just have hope that everything will get better one day, one day at a time.
One day at a time.
Well, the title of this meeting that we had was that it takes a village, and it absolutely does. And I think that the more we have that understanding that we're all in this together and trying to help each other through the ups and downs of life, that community, I think, is also what's very important for healing. And I love that we built this, and I love the family that we have now, that we can continue to hopefully, even just sharing these collaborations and these stories, hopefully inspire others to build that around themselves as well. Because I think that's where true healing lies. It's not just a prescription. It's not just one thing or the other. It's all of it. So thank you so much for being here.
I just want to add something that is still in my mind, and I think that was when everything broke down, and it changed my mind, and I'm not sure if at that time I was already working with Dr. Olivia, but when we start working together, Dr. Julapalli, then I remember with Donovan was all wrapped up, but I remember one night I emailed you at night. Then Nilton has one episode of anxiety and just that episode, and he was in his low that he can be in this situation. He told me that he don't want to live anymore. He asked me why happened this to him, and I email you. You told me, okay, I will send you an email with us to talk to him. You talked to him that night. That's when we changed the medication. But the words you gave me, you told him, to him, to me, it changed the whole route. That night was the worst night. But he got better for you because you.
Thank you for sharing that. That's how much we care. But that's, it takes a village.
It is.
It takes a village. And what that really to me means that we do what we do because of the relationship that we get to build, that sacred relationship that we get to build with our patients. We don't just see you as patients. Honestly, I won't speak for Dr. Olivia, but I know she feels the same way, is that when we take someone on as a patient, we treat them as if they are our own family, and how we would want to be treated if we were in that position. And I mean, I didn't have to think about it when I knew that you were in that level of trouble. There was no second thought. If it is in my ability to do that for someone, and she didn't tell me this before, but it's because when you're connected to someone and you have that sacred relationship of trust that we get to build, then you do what you need to do to help each other. So thank you for sharing that. And I'm so glad, I'm so happy that things turned around and that you were able to share this story of hope and triumph. I know we shared a lot about the pain and the struggles, but really it is a story of hope and triumph and love is what it all comes down to. So, so thank you so much for being here. And it is Eczema Awareness Month, but again, a lot of it is not just about the eczema. It's just about how you live and thrive with it as well. I think that's ultimately, what we're all trying to do, and in raising the awareness of it as well. So thank you so much for being here. Happy Monday, everyone. And yeah, we'll keep doing this if it's something that continues to help. One thing I always say is everyone has a story to tell, and I want to know yours. So I'm going to keep doing it as much as I can.